When you hear the phrase, just put this in your coffee and erections come back even at 80, it probably sounds too good to be true. And that's exactly why we need to talk about it. Every week in clinic, men and women alike whisper questions like this to me, often embarrassed, often desperate for clarity. And what they're really asking is, Doctor, is there something natural I can do to restore my body, my intimacy, my confidence? So let's start with honesty. Erectile dysfunction is not simply about aging, it's about blood flow, hormones, nerve health, psychological stress, and yes, even the foods and drinks we consume daily. Coffee, that warm, comforting ritual most of us can't imagine starting the day without, has been studied for its effects on vascular health and sexual function. And while no single ingredient is a magic cure, there are surprising ways coffee and what you add to it might support sexual health even in later decades of life. Now, why is this such an important conversation? Because erectile dysfunction doesn't just affect men, it affects couples, marriages, confidence, and overall well-being. For women too, changes in estrogen, pelvic floor health, and bladder control can ripple into intimacy, leaving them feeling broken or less than. But here's the truth I want you to carry with you today. Your body isn't broken, it's just misunderstood. The stakes are high. For men, poor erections can be an early red flag for heart disease. For women, vaginal dryness and pelvic floor dysfunction can create shame and silence when what's really needed is knowledge and support. And the danger isn't only in the condition itself, it's in the myths. You've probably heard that nothing works after a certain age, or that these problems are untreatable unless you're on strong medications. But the science says otherwise. So here's just what we said we're going to explore together. What caffeine and coffee actually do to your blood vessels, your nerves, and your sexual function. Which natural additions like L-Citrulline, L-Arginine, and even beetroot juice show clinical promise when combined with daily habits like coffee. The role of hormones like testosterone and estrogen, and why sexual health isn't just about the genitals, but about the entire body. The connection between erectile health and heart health, and why your penis can be an early barometer of your cardiovascular system. Pelvic floor health for both men and women, and how something as simple as targeted exercises can restore confidence. And finally, the realistic, empowering truth about what you can expect whether you're 35, 55, or 80 years old. This is not about gimmicks, it's about science, compassion, and giving you tools that actually work. By the end of this conversation, you'll walk away not only with knowledge, but with practical steps you can try tomorrow morning, yes, even with your coffee. Because you deserve to feel informed, empowered, and in control. Let's break this down, without judgment, just truth. One of the most common questions I hear in clinic is, Doctor, does coffee actually help with erections, or is that just social media hype? The good news is we have real data on this. A large study published in PLOS One looked at over 3,700 men and found that those who consumed around 2 to 3 cups of coffee per day, roughly 170 to 375 milligrams of caffeine, were less likely to report erectile dysfunction compared to men who drank little or no caffeine. The effect was strongest in men who were overweight or had high blood pressure, two very common risk factors for ED. Why might this be? Think of caffeine as a gentle vascular wake-up call. When you drink coffee, caffeine causes the smooth muscle in your blood vessel walls to relax, improving blood flow, not just to your brain to keep you alert, but to your entire body, including the penis. Erections are at their core a blood flow event. Arteries open, blood fills the erectile tissue, and veins temporarily close to keep the blood trapped. Anything that supports healthy blood vessel function, whether it's regular exercise, a Mediterranean-style diet, or yes, moderate caffeine, can help keep this process working smoothly. But there's a sweet spot. Too much caffeine, think 4, 5, 6 cups a day, can actually increase anxiety, raise heart rate, and interfere with sleep. And poor sleep is one of the most overlooked killers of healthy testosterone levels and morning erections. So, as with many things in medicine, the dose makes the difference. Now, what about what you put in your coffee? This is where things get interesting. Many functional medicine doctors and urologists recommend adding natural vasodilators or nitric oxide boosters to your morning routine. For example, powdered beetroot, rich in nitrates, can enhance nitric oxide production, the very same pathway medications like Viagra use to help blood vessels relax. Some men add a scoop of L-Citrulline powder, an amino acid found in watermelon, which has been shown in small studies to improve erection hardness scores. Of course, not everyone needs to turn their coffee into a supplement cocktail, but if you are someone dealing with mild ED, prehypertension, or sluggish energy, these simple additions can give your body a little extra support. Practical takeaway number one: if you drink coffee, aim for 2 to 3 cups per day, ideally before noon to protect your sleep. Pair it with a high protein breakfast to avoid blood sugar spikes, which can damage blood vessels over time. Practical takeaway number two: experiment with adding a teaspoon of beetroot powder or a daily L-citrulline supplement, but track how your body feels over a few weeks. Improvement is gradual. We're supporting physiology, not flipping a light switch. Have you ever noticed that your erections are better on vacation when you're less stressed and better rested? That's not a coincidence. Good sleep, good blood flow, and good habits all work together. If this resonates, drop a comment. You're not alone. And if you want more tips like this, subscribe. This channel is about giving you clarity without the medical jargon so you can make confident choices for your health. Here's something I hear all the time. Doctor, I think my testosterone is low. Should I stop drinking coffee or start drinking more? Let's unpack this, because hormones are often blamed for every sexual problem, but the truth is much more nuanced. Testosterone in men and estrogen in women are powerful drivers of sexual function, but they are not the whole story. And coffee actually interacts with these hormones in some interesting ways. For men, research shows that moderate coffee intake can slightly raise total testosterone levels and lower estradiol, a form of estrogen. One study from the American Journal of Clinical Nutrition found that men who consumed caffeinated coffee had higher circulating testosterone compared to men who drank decaf or no coffee at all. Scientists think this may be due to caffeine's effect on sex hormone binding globulin, SHBG, a protein that regulates how much free testosterone is available for tissues like muscles, brain, and yes, the penis. But, and this is important, too much caffeine can elevate cortisol, your main stress hormone. Chronically high cortisol can lower testosterone over time. So again, we come back to balance: 2 or 3 cups of coffee, likely helpful; 6 energy drinks, and poor sleep, likely harmful. For women, the picture is just as fascinating. Caffeine has been shown to slightly raise estrogen levels in women of reproductive age, especially those of Asian background, but can sometimes lower estrogen in postmenopausal women. This means your hormonal response to coffee might depend on your age, genetics, and whether you're taking hormone therapy or birth control. Why does this matter? Because estrogen isn't just a fertility hormone. It keeps vaginal tissues thick, elastic, and well lubricated. When estrogen levels drop during perimenopause or menopause, the vaginal walls thin and blood flow decreases, leading to dryness and painful intercourse. Supporting estrogen through lifestyle, including phytoestrogen-rich foods like flaxseed and soy, and working with your doctor on hormone therapy, if appropriate, can dramatically improve sexual comfort. Now, how does this tie back to coffee? Your morning ritual can be a powerful time to set up your hormone health for the day. Coffee before breakfast on an empty stomach can spike cortisol. If you're already stressed, this may throw off your hormone balance and leave you jittery. But coffee after a protein and fiber-rich meal can stabilize blood sugar, support hormone production, and give you a steady energy boost. Practical takeaway number one: if you suspect low testosterone, get it tested, don't guess. Blood work should include total testosterone, free testosterone, SHBG, and estradiol. If you're a woman with vaginal dryness or painful sex, ask your provider about local vaginal estrogen. It's one of the safest, most effective therapies we have. Practical takeaway number 2, try drinking coffee after breakfast instead of first thing in the morning. Notice if your energy feels smoother and if your stress feels more manageable. Small changes like this can make a big difference over time. Your hormones are like the conductor of an orchestra. When they're balanced, every section, libido, mood, muscle strength, and sexual function plays in harmony. When they're out of sync, even the best lifestyle habits can feel like they're not working. This is something I hear often in clinic. Doctor, why am I having trouble with erections when everything else seems fine? My heart checks out, my blood pressure is okay, isn't set, this just age. Here's the truth. Erections are often the first sign that something deeper is happening in your vascular system, sometimes years before heart problems show up on a stress test or EKG. Think of your blood vessels like a system of pipes. The penile arteries are only about 1-2 mm wide, much smaller than the coronary arteries feeding your heart. That means even a small amount of plaque buildup can restrict blood flow enough to cause erectile dysfunction long before you develop chest pain or shortness of breath. The American Urological Association and the Mayo Clinic both recognize ED as an independent risk marker for cardiovascular disease. In fact, studies have shown that men with ED have a 40-50% higher risk of future heart attack, stroke, or peripheral vascular disease compared to men without ED, even after adjusting for age and other risk factors. Your penis, in other words, can be an early barometer of your overall cardiovascular health. This is not meant to scare you, it's meant to empower you. If you notice a sudden drop in erection quality, especially if you're under 60, this is your body asking for a deeper checkup. Get your blood pressure, fasting glucose, HbA1c, and cholesterol checked. These numbers matter. So where does coffee come in? Moderate caffeine intake has been linked to lower risk of type 2 diabetes, lower risk of stroke, and better endothelial function, meaning healthier, more flexible blood vessels. Think of your morning cup as part of a bigger vascular care plan, alongside daily movement, a diet rich in colorful vegetables, and stress reduction. Practical takeaway number 1, schedule a full cardiovascular screening if ED is new or getting worse. Think of it as preventive maintenance for the whole body, because heart health and sexual health are deeply connected. Practical takeaway number 2, start thinking about your erections as a vital sign. Just like you track blood pressure or blood sugar, track your erection quality over time. Are they still strong in the morning? Are they lasting as long? These clues help you catch problems early when they are most reversible. And remember, this is common and it's okay to talk about it. In fact, talking about it can save your life. If this resonates, leave a comment. I promise you, thousands of other people are wondering the exact same thing. And if you haven't subscribed yet, do that now. We're building a space where we talk about these issues openly, without shame and with science as our guide. Let's break this down. Without judgment, just truth. Most people think of the pelvic floor only when something goes wrong, leaking urine, prolapse, or pain. But this group of muscles is one of the most important players in sexual function for both men and women. Think of your pelvic floor like a hammock, gently cradling your bladder, uterus, or prostate, and rectum. When it's strong and coordinated, it supports good bladder control, better orgasms, and fuller erections. When it's weak or overly tight, it can cause pain, erectile problems, premature ejaculation, or difficulty achieving orgasm. For men, the bulbocavernosus and ischiacavernosus muscles, two key pelvic floor muscles, actually help trap blood inside the penis during erection, making it firmer. Studies from the British Journal of Urology International have shown that pelvic floor exercises can improve erectile function scores in men with mild to moderate ED, sometimes as effectively as medication. For women, strengthening the pelvic floor can increase sexual sensation, improve lubrication, and help with orgasm intensity. It also reduces urinary leakage, which can be a huge source of anxiety during intimacy. So how do you know if your pelvic floor needs attention? Ask yourself, do you leak urine when you cough, laugh, or exercise? Do you have pain with penetration or difficulty achieving orgasm? Do you have difficulty starting or stopping your urine stream? If the answer is yes to any of these, your pelvic floor might be asking for help. Practical takeaway number 1, start with a simple exercise. Sit or lie comfortably, relax your belly and buttocks, and gently squeeze the muscles you would use to stop urine flow. Hold for 3 seconds, then relax for 5 seconds. Repeat 10 times, once or twice a day. Over time, build up to 10-second holds. Practical takeaway number 2, don't overdo it. A pelvic floor that is too tight can cause pain and worsen symptoms. If you feel burning, pelvic pain, or tension, see a pelvic floor physical therapist. They can assess whether you need strengthening, stretching, or relaxation techniques. And here's something important. Pelvic health is not just about down there. Posture, breathing, and core strength all play a role. Diaphragmatic breathing, where you let your belly rise and fall, helps coordinate your pelvic floor and nervous system, creating a calm foundation for intimacy. Have you ever noticed that your erections or arousal feel better when you've been exercising regularly, sleeping well, and feeling less stressed? That's your pelvic floor and nervous system working together in harmony. Remember, your body isn't broken, it's just misunderstood. Pelvic floor therapy can be life-changing, and it's available for both men and women. This is where things get exciting, because while pills and procedures can help, the most powerful medicine is often what you do every single day. Erections, libido, and sexual vitality are not accidents. They are the result of daily habits that either nourish or deplete your vascular, hormonal, and nervous systems. Let's start with movement. Regular exercise is one of the strongest predictors of erectile health. In fact, a Harvard study found that just 30 minutes of brisk walking a day was associated with a 40% reduction in erectile dysfunction risk. Exercise improves circulation, lowers blood pressure, boosts nitric oxide production, and increases testosterone. And it doesn't have to be complicated. Cycling, swimming, resistance training, or even dancing can make a difference. Next, nutrition. Think of your blood vessels like the irrigation system for a garden. If the pipes are clogged, nothing thrives. A Mediterranean-style diet rich in vegetables, olive oil, fish, nuts, and whole grains has been repeatedly shown to improve sexual function and reduce ED risk. Avoiding excessive sugar and processed foods helps prevent insulin resistance, which is one of the fastest ways to damage blood vessels and nerves. Sleep might be the most underrated habit of all. Most testosterone production in men happens at night during deep sleep. If you're sleeping fewer than 6 hours a night, you may be robbing your body of the very hormone it needs for desire and performance. Aim for 7-8 hours and consider a consistent bedtime routine. Dim lights, no screens an hour before bed, maybe even a warm shower to signal your body it's time to wind down. Stress management is also key. Chronic stress keeps cortisol high, which not only lowers testosterone, but also constricts blood vessels. This is why mindfulness, yoga, deep breathing, and even simple hobbies can have a surprisingly powerful effect on erections. It's not just mental, it's physiological. And yes, let's come back to your morning coffee. Make it part of a ritual rather than a rush. Sip it slowly, pair it with protein, maybe add that teaspoon of beetroot powder or a sprinkle of cinnamon, which helps regulate blood sugar. Use this time as a grounding practice before the day gets chaotic. Practical takeaway number 1, build a sexual health checklist for yourself. Daily movement, balanced meals, 7-8 hours of sleep, stress relief, and mindful morning coffee. Even if you can't do it perfectly, consistency is more important than perfection. Practical takeaway number 2, track your progress. Notice your morning erections, your energy levels, your mood, and even your confidence. These are powerful biomarkers of health. When you stack these habits together, you create a body that supports pleasure, intimacy, and vitality for decades. You're not just preventing ED, you're building a foundation for long-term health. Let's pause and take a breath together. We've covered a lot: coffee, hormones, blood flow, pelvic floor, daily habits. And if you're feeling both enlightened and a little overwhelmed, that's normal. The most important thing to remember is this: Your sexual health is not random. It's not just luck or genetics. It's the sum of your circulation, your hormones, your lifestyle, and your mental well-being. And that means there is always something you can do to improve it. Here's what we've learned today. Moderate coffee intake, 2 to 3 cups a day, can actually support healthy blood flow and, by extension, better erections. When paired with nitric oxide, boosting additions like beetroot powder or L-Citrulline, your morning ritual can become a gentle form of vascular therapy. We've seen that hormones matter, testosterone for men, estrogen for women, but balance is everything. Too little sleep, too much stress, and too much caffeine at the wrong time can all throw this balance off. Small tweaks like eating breakfast before coffee and protecting your sleep can set your hormones up for success. We've reframed erectile dysfunction as a vital sign, a clue, not a curse. If your erections aren't what they used to be, that's your body's way of asking you to check your heart health, your blood sugar, and your habits. Addressing these root causes now doesn't just help your sex life, it helps prevent heart attack, stroke, and diabetes. And we've shined a light on the pelvic floor, that hidden, hard-working group of muscles that holds up your bladder, rectum, uterus, or prostate, and plays a starring role in orgasm and erection quality. Learning to strengthen, relax, and coordinate this area can transform your confidence in the bedroom and beyond. Finally, we put it all together in daily habits. A few minutes of exercise, a colorful plate of vegetables, 7 to 8 hours of sleep, stress reduction, and a mindful morning ritual can literally rewire your vascular system and nervous system to support intimacy at 40, 60, and yes, even 80 years old. So here's your small but powerful step for tomorrow morning. Before you grab your coffee, take a minute to breathe deeply. Eat a balanced breakfast, maybe with some eggs or Greek yogurt for protein. Then enjoy your coffee slowly, not as a rush to wake up, but as a choice to nourish your body. If you want to experiment, try adding a teaspoon of beetroot powder or start a daily L-Citrulline supplement, but only after talking with your healthcare provider, especially if you take medications for blood pressure. Most importantly, talk about this. Talk with your partner. Talk with your doctor. Talk with friends you trust. These issues thrive in silence, and silence is what keeps people stuck in shame. When you ask for help, you start the process of getting better, and you remind yourself that you deserve care, pleasure, and confidence. Your body isn't broken, it's just asking for support. You deserve to feel informed, empowered, and in control. So stay curious, stay compassionate with yourself, and stay committed to small daily actions. Because sexual health is not just about sex. It's about your heart, your hormones, your energy, and your quality of life. If this helped you, like and subscribe for grounded, judgment-free education about sexual health, hormones, and vitality. Drop a comment and share what you learned. You never know who you might inspire by speaking up. You deserve truth, not shame, and we are here to give you both.